We are moving to H266, and we're going to have walkthrough with Legislative Council on the new language that has been crafted around all the discussion that we've had in the committee over this and possibly vote this soon. So you can go ahead, Jen.
Let me share. Oops. All right. Good afternoon, Jen Carby from the Office of Legislative Counsel. We are looking at draft 2.1. This is H266, an act relating to protections for 340B covered entities and 340B contract pharmacies, which, as I say it, maybe we want to look at updating the title at the end of the bill as well. But this is an amendment that is a strike-all amendment that is incorporating the changes that we talked about before and looked at before, striking out some language from the bill as introduced and adding in the section on reporting from H202 with some revisions. So let's look at what we have. Section 1, don't think we made any changes since last time. So this just has the language about the manufacturers and not the additional language on insurers and PBMs. And yes, no changes in section 1. Section 2 is the reporting on participation in 340B drug pricing, in the 340B drug pricing program. This would have, first we changed the date of the annual reporting from July 1st to January 31st so that it aligns better with the reporting on the hospital fiscal year, which runs October 1 to September 30th. It's aligned with the federal fiscal year. And so this would allow them to report on the previous hospital fiscal year. It would strike out numbers 1 and 2, the aggregated acquisition costs for all prescription drugs that the hospital obtained through 340B, the previous, and it had been calendar year, and also the aggregated amount that the hospital received for all drugs that it obtained under 340B and dispensed to patients. They would instead have the annual estimated savings to the hospital from participating in the 340B program, comparing the acquisition price of drugs under the 340B program to group purchasing organization pricing. And if group purchasing organization pricing is not available for a specific drug, the hospital shall compare the acquisition price under the 340B program to the price from another generally accepted pricing source. Then again, the change from calendar year to hospital fiscal year gets rid of reporting on other expenses, all other expenses related to administering the 340B program. And also gets rid of the names of all vendors with which the hospital contracted to provide services associated with its 340B program participation. It would keep the reporting on the number of claims for all prescription drugs that the hospital obtained through the 340B program during the previous hospital fiscal year, but would take out the specific language around the total number of claims and the number of claims reported separately by payer type, including Medicare, private insurance, and insured. And then we have 5 and 6 just renumbered, otherwise no change. And then this deletes such additional information as the board may request. Section 3 is the sunset we talked about, which is really a prospective repeal. So this would repeal section 2, that reporting on January 1st, 2031. So there would be reporting in 2026, 27, 28, 29, and 30, and then it would be repealed before the report is due in 31. The act would take effect on passage, and this would specify that the first report would be due by January 31st of 2026, so next January. That's it. We can look at updating the name if you would like. Maybe just something like 340B covered and act relating to 340B covered entities or the 340B prescription drug program, something sort of general. That's it.
Any questions for Jen? Any discussion? Anyone like to? Is there any confusion? Anything we need clarification on?
The other players in this, are they okay with this? We got one,
So.
in here.
So I'll be completely honest, the reporting piece. It's clearly not as comprehensive as what was in the original bill. I think this is consensus language amongst many stakeholders. I think that there may be some that have some concerns still. And, you know, if we pass this and if this bill passes the House, it will go to the other body. And that's the legislative process. And perhaps at that time, they can work on, I guess my thoughts around this were, what are we really trying to get to? What answers are we trying to get? You know, originally the 340, this bill started as 366, which, you know, helped with an issue that the hospitals were having around 340B, and then we added this reporting piece. And I think this language is good for what our intention is of what we're trying to do. But ultimately, I think that the bill is strong as it is because of the other sections. What do you have? I know that.
I didn't realize that the hospitals were having an issue with the 340B. I don't know who did or who was having issues with it. I am a little concerned about the Green Mountain Care Boards. It seems as though their authority is growing more and more as we take up various roles. And I guess that is a concern that I have.
Jen, I'm just thinking, so we set up last year within the Green Mountain Care Board, prescription drug affordability, moving towards that. And we've got 2 people already in positions who we got to meet the other day. Does the Green Mountain Care Board already have if the Green Mountain Care Board wanted this information from hospitals, do they have that authority in already to obtain that kind of information?
I would need to look at their statute. I mean, they certainly have the ability to ask for a lot of information as part of the hospital budget review process. So to the extent that it affects the hospital's budget, I think they likely could. Just trying to get to the statutory language here.
Well, I mean, but in answer of your question, I don't think we're actually giving Green Mountain Care Board authority over anything here. We're just saying we'd like the hospitals to report, and can you please send it to the board, and the board will post it publicly for all of us to see.
I think in the past, though, they've asked for it. And the hospitals have, you know, just simply volunteered and given it to them. I don't know, there's just a concern that I have.
So I actually worked on this bill quite a bit over the summer before I transitioned. And the hospitals and FQHCs wanted 340B to be on the table because the changes that drug manufacturers have done are hurting them, right? And so the intent, my original intent was to be able to put in statute to get us back to where we were so that FQHCs and hospitals can operate like they were before. And at the same time, I think it's really important that we get the data because one, I think it's really going to show Vermonters that this program ultimately helps fund things that hospitals and FQHCs wouldn't be able to do without it. And in our dire straits right now in healthcare, I think it's really important, like dental clinics or, going out and doing mobile health clinics or whatever the case may be. So I understand the concern about including Green Mountain Care Board, but I do think it's like the avenue that we have when we try to get information that it goes to them and it's going to help everyone see where we are with the 340B program.
I'm considering Green Mountain Care Board just the landing place for the information. We're not giving them authority over anything. We're just saying, here, hospitals, we'd like you to submit this information and can you please send it to the Green Mountain Care Board and the Green Mountain Care Board will post it.
Okay, and maybe I'm wrong, I mentioned it yesterday, but I do believe the Green Mountain Care Board, I read it, that said they could, by monitoring this, they could charge fees or service fees. This was originally when they came in, I think Diane might have said that, but.
That was last Friday, when she came in and presented her, if I may, her little addition.
Oh, that was the other.
Okay, I know I
Different
thought, okay.
Yeah.
That was completely different.
Okay, so the Green Mountain Care Board will not be charging any fees for monitoring to this or looking at everything. Okay, I'm okay then.
Will it help our hospitals, you think, in the long run?
Well, the entirety of the bill will help. I mean, both the hospitals and the FQHCs testified to how dramatically it was hurting them with the contract pharmacy piece, which is, really sections 1, 2.
That's right. Section 1 is the whole.
Section 1 is the whole contract pharmacy piece.
You want to put that on the spot, or do you want to hear from the representative of the hospitals?
I got a nod.
Okay.
And there's another nodder there.
That's all I want.
Okay.
I want to be sure.
Yes. And can we maybe get another nod from over there that this reporting piece is not onerous in any way and will be, well,
You're supportive.
Right. It's overly burdened, yes.
All right, any other thoughts, questions?
I created a clean version and did just put at the end and that after passage, the title of the bill be amended to read an act relating to the 340B prescription drug pricing program.
Great.
Work any issue with?
Do we have a new version number?
It's 2.2.
2.2. If there's no more discussion, I would entertain a motion that we move forward with draft 2.1 of H2. 2.2. So I know. 2.2.
I'm gonna move it.
So our clerk is out today and we've been advised by the house clerk, the other clerk, the big clerk, that we can appoint somebody in our clerks, that the chair can, and I'm appointing Wendy as our clerk of the day.
Clerk of the day.
No. And we'll help you out
Okay,
with getting everything in the right place.
thank you.
Will the clerk commence to call the roll? Oh, I'm sorry.
I just want to make sure something. Jen, you said that it would be 2.2.
2.2.
And not 2.1.
Right. 2.2 is the clean version with the updated title.
Okay.
I believe you're voting first on whether to amend the bill, right? As proposed in draft 2.2.
Yes.
Make sure.
Yes, that's what we're
Yeah,
doing.
that's what we're doing. And we'll work to make sure everything is, and that we submit this to the clerk's office.
So just point of order, the motion on the table is that the committee approves, the committee report to the body is that this is version 2.2, and then we vote yes or no.
And we're voting to
You have to take two
amend.
votes.
Okay, this is what I was getting at, yeah, so.
If you have to take, yeah.
Okay.
Clerk, just
So
clerk training.
this is, we're
on
going
this.
to.
I believe you'd have to take two
amending
votes.
to H266 with draft 2.2.
Yes.
And first we'll take that vote. Okay. This is different.
I don't remember taking two.
I don't ever remember
So
taking two.
I will confirm with the clerk's office, but that has long been my understanding, although not always the practice, and I believe that was just reiterated recently at committee clerk training. Such a committee clerk.
Sure.
I see.
Okay.
So we had strayed from the practice perhaps.
Well,
Okay,
if we,
so it's not that I'm just. being
Just
Just
like you do on the floor, right? You take a vote first on whether the bill shall be amended as proposed by the committee or whoever it is. And then, once you've adopted that, you take a vote on whether the bill should be read a third time. So this is sort of the equivalent of that. First, you vote to amend the bill as proposed, and then you take another vote to recommend the bill favorably to the House with amendment.
And that is the one that we submit to the clerk's office?
Yeah, I mean, it's the same document. You are, in this case, you're voting on effectively the same thing twice. But again, as you do on the floor, where you first vote to adopt the amendment and then you vote to approve the bill. The bill read.
So it would be favorable with amendments? According to.
Yes.
Okay.
Let the clerk.
One more technical question. I could open this and read it, and I'm just gonna ask Jen, because you probably could just answer this quickly. What kind of amendment? Is this a strike all?
Yes.
Thank you, that's.
Okay, ready? Ready.
Okay, so I start with Brian because he's number one, right? And then I go back to you guys. Okay.
For one.
There's a question.
Okay, what's the motion? We gotta have that down.
Leslie made it.
I did.
Okay,
I move that we
amend.
Adopt
Adopt your-
2.2.
No, it's amending it.
No.
amend. Let's just
Yeah.
vote to adopt this bill, this H266. And then we'll vote to amend it to.
No,
to-
you amend
You gotta put the
Amend
amendment.
it first.
So, okay, someone tell the language.
Your original motion was to
Brian,
accept
would you like
version.
to make a motion?
Well, I can, if you withdraw yours, because you.
Withdrawn.
I make a motion to amend I'm just want to get the number right.
266.
Thanks. Okay, I make a motion to amend H266 with draft 2.2. And post it on our website now, written by
Soon.
Jen Carby.
2.2, right?
So just one more clarification question. Okay, so there's two votes right now. So the first one, is it recorded or is it just a?
Recording both of them.
Okay, so this is not the favorable with amendment. That's the second vote we're taking, correct?
Right.
There's no option on here to just amend it. That's.
There isn't.
You'd have to circle other and say amend and then favorable,
Okay.
which is weird, because you see, they have it, so it's just favorable.
that's because you get a clean copy that has 2.2 on it.
Yeah.
And you only have one vote.
Let's
Let's-
call the roll.
Okay, so this one is for the amendment, correct?
Yes.
Okay. Representative Gina?
There was no second on the motion. Did there have to be?
Okay.
Okay.
One.
Yes.
And Marie is absent, correct? Me, I'm voting yes. Representative Demar,
Yes.
Representative Goldman,
Yes.
Representative Houghton,
Yes.
Representative Page, Representative Powers,
Yes.
Representative Alyssa Black,
Yes.
Representative McFawn,
Yes.
and Representative Rebecca.
Yes.
Okay, so that would be.
10-0-1.
Yeah, I have to count.
I'm sorry.
Okay,
So we have amended the bill
that's
and
just this is. the
and we
amendment.
are now voting on whether to approve the bill as amended. I would entertain a motion.
So moved.
I'll second.
We don't need a
We don't need a
second.
second.
Okay. All right. Representative Gina.
Aye. Yes.
Okay.
Let's see.
Representative Critchlow, that's me, yes. Representative Demar,
Yes.
Representative Goldman,
Yes.
Representative Houghton,
Yes.
Representative Page.
We, yes.
Oh, yeah, I'm getting ready.
He's on his way to Montreal.
Yes. Representative Black,
Yes.
Representative McFawn,
Yes.
and Representative Rebecca.
Yes.
Thank you very much, everybody. We